Morning. First of all, thanks for this chance, and thanks Bentex for sponsoring our program. I'll go briefly through endoscopic ergonomics. First, I'll introduce the ergonomics. Ergonomics is the study of the interaction between people and their work environment, and aim is to reducing the risk of musculoskeletal injury of endoscopists. ASGE emphasized the ergonomic directly impact the clinic's performance and outcome of endoscopic procedures, and gastroenterologists spend approximately 43% of their time engaged in endoscopic procedure, so this prolonged time may lead to endoscopic-related injuries in the hands, fingers, back, and neck. And SGA survey showed that 89% of endoscopists reported work-related musculoskeletal pain. And this pain increased by increased volume of procedures and more time spent at the procedures, and female gender more liable for injuries more than men. So the body posture, endoscopic frequent adopt awkward static posture and repetitive involuntary movement that may lead to musculoskeletal injuries, and prolonged neck flexion also may lead to that injury. Also repetitive movement like hand torque and scoop weight and other may lead to also injury. So SGA recommended that female endoscopists are high risk of ARI, so they recommend that ergonomics education for all teams of endoscopists to decrease the risk of endoscopic-related injuries. Also, personification or becoming the scoop, this repeated and repetitive movement as you're going through the lumen may also increasing that the risk of musculoskeletal injury. So that to prevent the musculoskeletal injuries, SGA highlight the importance of daily stretching exercise and micro breaks and macro breaks through the days. And this video show that the stretching finger for 10 seconds. After that, rest stretch for other 10 seconds. And then rest roll in both directions for 10 seconds. After that, shoulder stretch for 20 seconds. And shoulder rolls for 10 seconds or 5 times to back and 5 times to forward. And finally, forearm stretch for 30 seconds. The micro breaks, meaning that the stretching between the procedures, if the procedure more than 30 times, and macro breaks is a planned break for 15 to 45 minutes through the day. After that, I'll go through ideal endoscopic suite setup. According to SG guidelines, monitor should be placed directly in front of the endoscopist, just below the level of eyes. Optimal angle of 15 to 25 degree below the horizon from the eye, and the distance about 52 to 182 centimeter, and to accommodate the 15th percentile female to the 95th percentile male, and the standard monitor should be adjustable from 93 to 162 centimeter above the floor. So that if the monitor is above or below the level of eyes of the endoscopist, may lead to increasing the neck strains and decrease the task performance. Also, the table height should be adjusted from 85 to 120 centimeters, and the bed height should be adjusted to allow holding the endoscopy between the elbow height and or till 10 centimeters below the elbow height. Also, in correct position of height of the bed, allowing the surgeon to increasing the risk of musculoskeletal injuries. So the recommendation is SGA recommends a neutral monitoring position during endoscopy to decreasing the risk of ERIs, and also recommend the use of neutral bed height to decreasing the risk. Also, the use of floor mats was associated with less pain and decreased overall discomfort, and many studies also related to GI endoscopy, specifically related to the use of lead aprons during the fluoroscopy, may increasing the weight over the backs and hip joint, so the two-piece lead apron may decreasing the risk. Also, the SGA suggested the use of anti-fatigue mat to decrease the risk of ERI, and also recommend the use of neutral bed height to decreasing the risk. And finally, the recommendation is the SGA recommend ergonomic education to decreasing the risk, and also a neutral monitoring position and the neutral bed height, and macro brake and micro brakes and stretching is very important, and anti-fatigue mats to decreasing the risk of ERIs. Finally, incorporating ergonomics practice in GI endoscopy is not only essential for enhancing procedural efficacy and patient outcome, but also critically in safeguarding the long-term health and well-being of endoscopists. And finally, thank you.